Hello, welcome back. The topic today is importance of nutrition in stomach cancer. So in the previous videos we saw about what is cancer stomach, their causes, symptoms, how to treat and all. Because it's the fifth common cancer in the world. So it's such an important cancer, and moreover it happens in the stomach itself, because then the nutrition of the stomach is a structure. It's almost 2 to 2.5 liters capacity balloon-like structure where the food goes, stays, been churned and been digestion happens and been food and nutrition are absorbed. So now there is no stomach, then how the nutrition will go? So this is very important. So that's why this video. We all know all cancer treatment mainly the success rate depends upon the nutritional status of the patients. Performance status is the physical health status of the patient, but the nutritional status is very important. In cancer stomach, as I said, some cancers can be treated by surgical, or some cancers cannot be treated. So the nutrition is very important. The nutrition in stomach cancer is not only a supportive treatment, sometimes it acts as the treatment. That is only the treatment. Some cancers, very advanced cancers, we cannot do much about the surgical treatment or chemotherapy or radiotherapy. Then the patient, it's like a palliative treatment. Palliative nutrition therapy is a very important. And other cancers, suppose a cancer can be operated, can be resectable cancers that can be operated. So there also most of the time it's followed by chemotherapy, or even before that chemotherapy and radiotherapy sometimes can be combined. So nutrition is very important. Why? Again, there is the stomach is completely absent, or it's been partially cut, and the digestive tract is realigned. The third, because of the vomiting, because of the chemotherapy or even because of the surgery, they keep vomiting. So these are the reasons why the nutrition plays a very major role. And usually anything through the mouth, that is the best way to give the food, because it's very natural, it's very cheap, and the functional and the functional integrity of the intestine is maintained by taking food naturally. Now, suppose if the patient is operated, and if they can take food through the mouth, that is the best way. Usually, that will be planned. And though they cannot take good quantity of food, but at least they can have small quantities of food and through mouth. And those patients who cannot, then there are other options. We should divide into two things. One is enteral feeding, other one is parenteral feeding. Enteral means through via naturalis, through either the food goes through the intestines, or mouth, or some stomach, or the intestine via natural pathway. Enteral feeding is through the peripheral, through the blood vessels, either in the peripheral or in the central line. Okay, so enteral feeding, we come to the enteral feeding. If the patient can take food through the mouth, that is the best way. If not, either because of the size of the stomach or because of the vomiting, most of the time we can give the food through the nasogastric tube. Probably you have seen in some movies where the tube is inserted to the nose and goes to the foot pipe, and and goes to the stomach, or even lower down also, where we can give a liquid diet, or even solid diet can be made into very liquid, and calculating the patient's requirement of calorie, protein, vitamins, and everything can be calculated and can be given through the nasogastric tube. And if not, then there are other options. Probably you would have seen putting a tube through the abdominal wall into the stomach itself. That's called PEG, percutaneous gastrostomy. That means endoscopic gastrostomy. Through the endoscope, we put a tubing directly into the stomach. Or then one more is called PEG-J, percutaneous endoscopic gastrostomy and jejunostomy. And the tube is through the stomach gone into the small intestine. Or this can also be done by radiologically, but the tube will be outside the. We can see the external of the tube through which food can be given. Even then, any normal food can be made into little liquid form. In the liquid form, it can be given both quantity wise, quality wise. You can give good food. So these are the enteral feeding types. These are very cheap and they are very natural, so the complication rate is very less, and even the patient attenders, they can easily feed the patient, or even the patient themselves can feed. This is one part. Then comes the parenteral nutrition. Parenteral nutrition through the blood vessels, either the peripheral one or the central one. Again, here it's all artificial. These are made artificial. It comes in packets depending upon the patient's requirement of calorie, proteins, vitamins, fat. All these things calculated, and they are given through the vein, to the peripheral or the central one. Again, this is not natural, or this is an artificial one, and it's very costly, and the complication rate is little higher, very high, especially infection or electrolytes imbalance, or people with some cardiac problem, all these things. So we cannot give more, we cannot give less, and they can also cause some organ damages and all. So it is a little costlier, as well as complication rate is very high. But whatever the possible way we can give, we have to give the nutrition, because for any cancer, nutrition is very important, because the success rate of the treatment mainly depend on the nutrition. With a good nutrition status, the patient recovers fast, the success rate is very high. So so that is why even before the surgery, or even before starting any treatment, usually the doctors, they sit with the patient and explain all these things, and the dietitian or the nutritionist come and examine. They will calculate according to the patient's surgery, type of chemotherapy, and type of their depend upon the diseases like diabetes. All this, they pre-calculate everything even before the treatment starts, and accordingly they will give the treatment. And nutrition is very important for even normal patients. Not only normal patients, it's very important for any cancer patient, especially cancer stomach patients. Thank you.